All right, let's get into our interview now and talk about World AIDS Day. So the World AIDS Day, it's an international community day where, of course, the focus is on how to end the HIV/AIDS epidemic by 2030. Experts believe this can be done by overcoming barriers to HIV care and treatment through focusing on priority populations. The Broad Reach Group recently hosted a panel discussion with various HIV experts to discuss what needs to be done to better understand the barriers preventing at-risk population groups from accessing HIV treatment and care. For a conversation on this, let us welcome to the program Dr. Ernest Darkoh, who joins us virtually. Great to have you, Doctor. Thank you very, very much for your time.
Hi, Leanne. Thank you for having me on. Good morning, listeners.
So talk to us about the Broad Reach Group. What exactly is the Broad Reach Group? And I know that you spoke, as we said in the introduction, about HIV at a panel discussion with some key experts, and a lot of highlights were issued. Perhaps you can talk to us about some of those highlights that you spoke about.
The Broad Reach Group is a group of companies really focused on improving the health and well-being of populations worldwide. And we do that primarily by working to improve and strengthen health systems. That is basically the means of delivering high-quality health care to the largest possible populations. HIV, as you know, is really one of the biggest issues of our times. And if you look at Africa, Africa alone accounts for the largest percentage of HIV on the planet. And then within Africa, South Africa accounts for the largest proportion. So as a country, our population estimate recently is about 60 million. We have about 8.5 million people infected. That's 22% of the global total. And you know, the good news is that HIV is treatable and that treatment actually equals prevention. So people who are successfully on treatment and undetectable do not transmit the infection. The big problem is we're not doing enough to stop new infections. So in essence, we're chasing a snowball that is growing bigger and bigger in front of us. And that becomes unsustainable in the long term because there's a lot of other priorities in health and in other sectors that require the budgets that we have. So we can accomplish this, but we have to become really serious about first turning off the tap, so that then we can mop up what's there using treatment. And treatment is extremely effective. People who are HIV positive can have a normal life expectancy like anybody else who's uninfected. But we do have to address some key challenges in getting to the milestone of having everybody on treatment and that treatment remaining effective for those people. And when you have very large numbers of people on treatment, that innately has a number of challenges that come along with it in terms of like, how do you keep on delivering this consistently to them? How do you deliver in rural areas? How do you deliver to people who don't understand English, for example, and don't understand the importance of why they need to take the treatment? So there's an array of challenges that we need to address and get right. But the good news is we can do this in our lifetime, and we can actually do this by 2030 if we're intentional and really resolved about this.
You know, the reality is that we still have a very high, as you mentioned, I mean, South Africa is sitting up there when it comes to the HIV infection rate, which is a great worry. And add to this the amount of South Africans that die annually of AIDS. I mean, it's a big number. I mean, we're sitting at approximately, I mean, I don't know the exact number, but I think it's around 89,000 people, 88,000 people, somewhere around there. And we lose this on an annual basis. And these are far too many people to lose, especially when it is treatable, it is preventable, and it's been around for so many years. Does this just tell you that perhaps we're not out there enough? Perhaps there's been a little bit, you know, a bit of silence, and it's been sort of not spoken about as much as it used to in previous years when it comes to the protection and the whole idea around HIV/AIDS.
Yes, and this is what you mentioned is absolutely key, because every death, even a single death from HIV, is one too many, given that it's completely preventable, right? And so why are we still seeing this? And to me, the real big issue is stigma. And stigma, to me, is a reflection of the fact that we are not as compassionate as we say we are. We are not as kind and caring as we say we are. Because if we are compassionate, if we are people who care, if we are people of various religions who actually adhere to the tenets of those religions, then stigma should be a thing of the past. However, unfortunately, the HIV is stigmatized. That leads to fear. Fear leads to reluctance to test. Once tested, delays in seeking treatment until you are literally on death's bed. At that particular point, even sometimes the treatment may not work, and that's how we see the deaths, or it works, but you're left with, again, lifelong problems because the disease advanced too far. So addressing stigma is absolutely critical for us, I think, at this particular stage where we can see the end in sight. However, those last few steps we have to take now are the hardest ones, because we have to tackle some of these issues that are complex. They have social cultural roots. They have deep psychological roots. This is frankly the domain of behavior science, not so much medical interventions. A doctor can give you a pill. A doctor is not good at necessarily addressing what are the social cultural drivers of behavior. And so including behaviors that lead us to stigmatize. So these are things. Stigma is something we really do have to address head on, and we need to get the right knowledge about what we need to do, and we need to implement these programs very aggressively. So we talk about HIV, but we then still stigmatize it, and I think that is something we have to stop doing.
I mean, the stigma is a major issue, and one would have thought by now we would have moved through this, but it's still something we're dealing with. But also importantly, and this is a very, very big issue, is the most vulnerable populations that are affected by this. And this is where I refer to, and we saw this also in the insert. We talk about young teenage girls. And I know that this is the most affected portion of the population, whether we're talking about, getting engaged in sexual activities at a very, very young age with older men, also the issue of gender-based violence and the issue of rape in South Africa. These are all things that we deal with here in South Africa. And of course, with this comes the issue that you may very well get HIV and AIDS from this. So young teenage girls, let's talk about that.
It's important that we protect young teenage girls at all costs. What's happening right now is a travesty. Because the thing that's often not stated is those young teenage girls are being infected by much older men. Right? And so that de facto is statutory rape. And they're vulnerable because they're young. These are women who actually can't consent in many cases to sex based on their age legally. And so it is a massive, massive problem. And we have to approach this from two sides. Often you see people this approach as though let's just focus on the young women and girls, but it's the men who are infecting them. We need to equally focus on men. And it's not necessarily, this has, again, very deep social, cultural, psychological, behavioral roots that we need to unpack, as well as to why do we have this dynamic. But we really do need effective programming targeted at young girls and at men as well, so that we can basically bring a halt to this. There's a program called DREAMS, supported by PEPFAR, that is being implemented, which is about keeping young girls in school. We know just keeping girls in school reduces their chances of infection by 50%. But, to me, as a society, this is something we can literally change tomorrow if we resolve ourselves to change it. And we need to be much more aggressive about stopping this situation.
Very, very quickly, I'm sorry, we're running into time, but I just want to talk about that goal, that 2030 goal that's been set of the UN AIDS, basically that target to say 95, 95, and 95. And this to just explain it to viewers, 95% of HIV positive people know their HIV status. That's the 195. The other 95% of people diagnosed with HIV receive ARVs, and 95% of people on ART have viral suppression. That's what the sustainable goal says. We're there. We're knocking on 2030's door. How is this achievable when we're sitting with numbers like this, and the awareness is just honestly not happening right now?
Absolutely. So the good news in South Africa, we are doing really well in terms of progress, although yes, COVID has interrupted that a bit, but we are actually have been doing very well in terms of working our way towards the triple 95. For example, take KwaZulu-Natal, many of the districts are in the 90s already. So it's not that big of a challenge. It becomes big when we don't stop the new infections, obviously, because then we keep moving the goalpost. However, it is within reach, but what is required is, I'd say, ironclad resolve and really disciplined implementation of implementing things that we know that work, that can get us across the line. Other countries have done it and are there already. So there's a template for doing this successfully, and we can just follow that template and be as successful as well as South Africa.
Amazing. Throw me the name of the country. Who can we look at? Tell me who we should look at.
We can look at Botswana.
Yeah.
For example, and I think we could look at, I think it's Swaziland as well.
Fantastic. Well, we'll look at those, have a look and see what they've done right. But thank you very, very much for talking to us here on the program. A very, very important day. And I know that the Deputy President is the man responsible this morning, or today, to give the message on World AIDS Day here in South Africa. And that's taking place in Bloemfontein. But thank you very much to our guest, Dr. Ernest Darkoh, the co-founder of the Broad Reach Group, talking to us about the barriers to overcoming HIV treatment and care.